Right now, we need to understand more about the basics of absorption, and for that discussion, we're going to take the example of an oral medication. As you take an oral medication, the medication goes down the esophagus into the stomach. There's generally very little absorption that occurs in the stomach. Even aspirin, which has chemical properties that favor absorption in the stomach, doesn't normally have a very high percentage of absorption from the stomach because of a couple things. First of all, aspirin isn't in the stomach very long, and secondly, there's very little surface area for absorption in the stomach compared to that of the intestines. So most of the absorption of orally administered medications usually occurs in the small intestines. There are a lot of factors involved in the absorption of orally administered medications, and a lot of those have to do with the properties of the drugs themselves. For instance, the molecular size of the drug, the acidic or alkaline nature of the drug, and whether the drug generally has a lipophilic or hydrophilic property. For instance, lipophilic or fat-soluble drugs are normally absorbed faster and more completely because they can simply diffuse across the cell membranes of the gastrointestinal tract wall. Other factors that affect the absorption of medications include the specific conditions of the gastrointestinal tract at the time. For instance, drug absorption is affected by the rate at which the contents are moving through the GIT. Another factor that affects absorption is blood flow through that area. And this is an interesting one. A meal increases the blood flow through the GIT, so you'd probably predict that it's best to take medications with food. But in reality, food often decreases the bioavailability of the drugs, or in other words, decreases the fraction of the drug that ultimately reaches systemic circulation unchanged. So although taking the drugs with food generally speeds up the absorption of drugs, it generally decreases that bioavailability, and therefore, in general, oral drugs are best taken about an hour before or 2 hours after a meal. After the drug has dissolved into tiny little fragments in the stomach and is in the small intestine, the drug's going to be absorbed into the bloodstream by a number of different mechanisms. And the most common way for a drug to get absorbed is by simple diffusion. In that process, the water-soluble products will move across channels in the cell surface, and they're going to move from the area of higher concentration to the area of lower concentration. But if it's a lipid-soluble drug, or in other words, lipophilic, that drug can simply diffuse from one side of the cell membrane to the other. And once that medication is absorbed, that medication is ready for the next process of pharmacokinetics, which is the distribution of drugs. Recall what we were saying about the absorption of medications. Generally, the best absorption, in other words, the fastest and most complete absorption, normally comes with A, lipophilic or fat-soluble drugs, or B, hydrophilic or water-soluble drugs. And you would have been correct if you had recalled that lipophilic drugs are generally absorbed the best. This is especially important in some types of administration, such as topical administration, because the cells on the skin have a protein called keratin that protects the skin from absorbing water-soluble products. This is the reason that ingredients within creams, which are fairly water-soluble, are poorly absorbed. They generally stay in that local area. Conversely, transdermal patches are made with lipophilic drugs to make sure that they permeate the skin to the deeper layers where they can access the blood supply. The lipophilic nature of drugs is also important in sublingual sprays, so sprays that are administered under the tongue and for rectal suppositories. And the important thing to remember about those applications is that the drug is applied in a very limited area. Remember, water-soluble drugs can be absorbed from the intestines, but the small intestine is made for absorption. It has over 30 square meters of area with the villi and the microvilli. That's about 320 square feet. So using that information, what would you predict would happen if you, for instance, crushed a medication, suspended it in an ointment, and applied it rectally? And by the way, ointments are oil-based substances that are topically applied. And the answer to that question is variable depending on the properties of the drug itself. A very lipophilic drug may indeed be absorbed fairly well, but remember that oral medications are exposed to many thousand times the surface area as compared to rectally administered medications. So the result is going to be unpredictable. Always administer medications in the way they've been proven to be absorbed, effective, and safe.